Antimicrobial prophylaxis. Clinical scenario. Prevention of streptococcal pharyngitis in a child with a history of rheumatic fever. Recommended medication. Benzathine penicillin G, intramuscular, every 3 to 4 weeks, or oral penicillin V, daily. This prophylaxis is essential to prevent recurrence of rheumatic fever, which can worsen heart valve damage. Question 1. A 10-year-old boy with a history of rheumatic fever 2 years ago is in good health today. What is the most appropriate medication to prevent recurrence? A. Azithromycin once weekly. B. Oral amoxicillin daily. C. Oral penicillin V daily. D. Ceftriaxone monthly. E. Trimethoprim sulfamethoxazole daily. Correct answer, C. Oral penicillin V daily. Explanation. Daily oral penicillin V is a standard regimen for secondary prophylaxis against group A streptococcal pharyngitis, which helps prevent recurrent rheumatic fever in patients with a previous episode. Why not the others? A. Azithromycin may be used if penicillin allergic, but not first line. B. Amoxicillin, used for treatment, not standard for long-term prophylaxis. D. Ceftriaxone, injectable, not commonly used for this indication. E. TMPSMX, not effective against group A strep. Question 2. A 13-year-old girl with a history of rheumatic fever presents for a routine follow-up. She has trouble remembering daily medication and prefers fewer doses. Which of the following is the best prophylactic strategy? A. Oral penicillin V daily. B. Intramuscular benzathine penicillin G every 3 to 4 weeks. C. Oral amoxicillin once a week. D. Oral erythromycin 3 times daily. E. No prophylaxis needed after age 10. Correct answer, B. Intramuscular benzathine penicillin G every 3 to 4 weeks. Explanation. Benzathine penicillin G given intramuscularly every 3 to 4 weeks is ideal for patients who struggle with daily pills. It is a reliable and effective long-term strategy to prevent group A strep infection and recurrence of rheumatic fever. Why not the others? A. Oral penicillin V, effective but requires good compliance. C. Amoxicillin once a week, not proven effective for prophylaxis. D. Erythromycin, used only in penicillin allergic patients and requires frequent dosing. E. No prophylaxis, incorrect, prophylaxis is still needed for years after initial rheumatic fever episode.